After 5 years of using Healthy365, checking my daily steps and collecting health points has become part of my routine. Doing 81 previously made me realize my blind spot where I tend to trust digital platforms without really questioning them. Since I've used Healthy365 for so long, I overlooked many of its design choices because they felt normal. I began seeing step goals, exercise, and sleep targets as natural indicators of being healthy, without questioning why these behaviors were prioritized. Recognizing these biases made me ask, what counts as being healthy in the app and why is it designed this way? To find the answer, I researched Healthy365 to understand why it was created and who shaped the way it works. Developed by Singapore's Health Promotion Board, the app encourages healthier lifestyles by rewarding everyday behaviors such as achieving step goals, enough MBPA, sleep goals, and choosing healthier choice products. Behind these interactions is a carefully designed system shaped by healthcare researchers, policymakers, developers, and designers based on public health research and national health guidelines. This made me realize that Healthy365 isn't simply measuring health, it translates medical knowledge into a designed experience that shapes everyday behavior. After understanding how Healthy365 is designed, I wanted to know whether it has actually improved public health. From my own experience, I assumed Healthy365 would be more effective for people who were already active before using it. As I researched online, I came across a study on Singapore's National Step Challenge. It found that participants increased their average daily step counts, with the greatest improvements among those who had previously been inactive. This challenged my initial assumption and showed that Healthy365 can increase physical activity across the population. I then wondered what other health benefits the program might bring. Another study explored its long-term health impact and projected that continued participation could reduce obesity and type 2 diabetes rates by encouraging more active lifestyles. Together, these studies suggest that Healthy365 actively encourages healthier routines through its system of goals and rewards. This led me to another question. Is this the only way to encourage people to be healthy? Looking at other programs, I realized there are different ways to design for health. While Healthy365 encourages healthy habits by rewarding behaviors that can be easily measured and tracked, AIA Vitality uses a similar reward system. Users earn points through healthy activities that can be exchanged for rewards. Parkrun takes a different approach. Instead of rewards, it encourages people to join free weekly community runs and walks. It builds an inclusive community when people of different ages and fitness levels exercise together, improving both physical activity and social connection. Although all three programs encourage people to be more active, they motivate people differently. Healthy365 and AIA Vitality rely on rewards, while Parkrun focuses on community. This made me realize that Healthy365 doesn't just encourage healthy behavior, it shapes how people are encouraged to be healthy. Looking back, I noticed a pattern. Health is represented through measurable progress. Walking becomes step counts, exercise becomes minutes, and sleep becomes hours. These measurements make health divisible, but they also make me question what cannot be measured. Emotional well-being and meaningful relationships are equally important, yet because they cannot be easily tracked or rewarded, they receive less attention within Healthy365's definition of health. Unlike Parkrun, Healthy365 focuses on behaviors that can be measured and translated into data. This made me realize that it mainly defines health through measurable data, while experiences that cannot be easily measured receive less attention. This doesn't mean Healthy365 is wrong. Instead, it reveals how design reflects particular values. By deciding what should be measured, rewarded, and made invisible, designers influence how people understand and what it means to be healthy. This showed me that designers do more than creating interfaces. Through rewards and feedback, they shape how people experience health. Before researching Health 365, I simply saw it as an app that encouraged people to exercise more. Because I had been using it for years, I accepted its definition of health without questioning it. Looking back, I realized my familiarity had become a blind spot. Researching the app and comparing it with other health programs helped me see beyond my perspective as a long-term user. I began questioning what kinds of health it values, why certain behaviors are prioritized, and what experience become less visible. As I continue learning as a designer, I want to think more carefully about the values my designs communicate and whose perspective they include or leave out. This experience changed how I think about design. It isn't just about creating engaging interfaces, but also about shaping how people understand the world around them.